Congratulations on getting your braces on. We have a few post-op instructions to make sure your braces experience is as good as it can be. The first thing to realize is you need to protect your lips and gums because you are not used to wearing braces. Your body is not used to you having braces. And it's going to be very common for the first 1 to 2 months to accidentally cut yourself. So we have wax for you, and we recommend you putting wax on your braces as you speak and talk so you don't cut your mouth. After about 1 to 2 months, your body gets used to those braces and your lips just naturally rarely will get cut by them. But for the first 1 to 2 months, it can happen a lot. So we recommend putting the wax. Sorenesses. You can be pretty sore after braces. It's unique how braces work. You come in, you're not sore. We do the adjustment, we do all these, and then about 3 to 4 hours after you leave us, you can get extremely sore. So what we recommend is taking pain medicine for it. Usually the soreness lasts 2 to 3 days and then goes away until you come back the next month and have the same thing happen again. And usually we do that for up to about 2 years while we're doing your adjustments for your braces. The soreness, I mean, that's what it's like going to the gym. You're sore because your teeth are moving. That's what you want to have happen, and that's just how we have to do it to adjust your teeth. Cavities. The rates of getting cavities is 3 to 4 times higher than it is without braces. So you've got to be extremely, extremely good at taking care of your teeth. I've seen too many people take their braces off and have these white stains around their braces. And you don't want completely nice and perfectly straight teeth with cavities. You want nice, perfectly straight white teeth that will look really nice. That's the whole reason you're doing braces. And make sure to be brushing. You got to be brushing after every single meal. So not just 2 times a day, but 3 or 4 times a day. You should be flossing both in the morning and the evening. You got to be using mouthwash at least once a day. Eating. Eating's going to be a little trickier. Again, for the first few days, you're going to be quite sore. And so you're going to want to eat soft foods. And you got to be careful what you eat. You don't want a bracket to break off because that leads to the next one, breaking brackets. If you have a bracket that falls off, you want to come back as soon as possible so we can re-cement that bracket. A broken bracket means that tooth is no longer in the track, and because it's no longer in the track, it can move however it wants, and lots of times it might completely move in the wrong way because we're putting pressure on the other teeth to put pressure on that one, and not having the bracket, it's going to go in the long way. So sometimes we've had patients break a bracket, not come in, and then when they eventually do come in, it's another 2 to 3 extra months because 2 to 3 extra months just to move that tooth back to where it had moved since the bracket had broken. So in summary, you break a bracket, come in as soon as possible. Adjustments. We do adjustments every month. Well, 95% of the time we do it every month. Once in a great while, we'll say we can see you in 2 months or we can see you in 2 weeks. But on the typical patient, it's 4 weeks. And we are expecting you to come back in those 4 weeks. If you miss an appointment, it's important to come as soon as possible because there's been times we've had patients miss for 3 to 4 months and their teeth are completely in the wrong way. Their teeth are extremely at risk because we weren't expecting the teeth to move as far as they did because we were expecting them to come back in 4 weeks. So in summary, make sure to stick to your 4-week appointment adjustments and make sure to make your appointments. Poking wires, loose wires. It's common to have a wire poke you, a wire to get loose. That just happens. That's what happens with braces. So if that happens, just call our office, come in, and we will fix it. And those are basically the quick summary of the post-op instructions for braces. But like always, if you have any questions, feel free to call us, write to us on social media, or email us. And also, feel free to check out our website where we go in a lot more detail about post-op instructions for braces.